Matthew Holt, Quickbite here at VIVE with Joe Gagnon. We've got your pronunciation right there, Joe.
Yes,
here's the CEO of 1upHealth. Let's start with the basics, Joe. What is 1upHealth?
1upHealth is a data interoperability solution based on FHIR. We sort of connect and compute on all forms of data, claims, clinical, and device data to allow for improved outcomes for both, patients, providers, and plans.
So mostly, when I first met your company, not you, but your company, where they went and launched a Health 2.0 a while back, you were building an application sort of ecosystem to put that together. The last couple of years, you changed your focus, been looking mostly at health plans. So tell us about the growth in the last couple of years and what the plans who are using you are using your tools for.
Yeah, we started as an API for app developers to provide for patient-mediated access to plan data, claims data or clinical data, and then we evolved to really helping health plans think about sort of the next generation of data access. So we took the APIs, we built a cloud platform to be able to take that legacy data, map it into FHIR, platform it in the cloud, and then provide analytic access to that data so that you could do it off of a modern computable platform.
So you've got a bunch of health plans. I think you mentioned 44 health plans on there. You mentioned Aetna, Cigna, a few others, smaller ones. Tell me about, they have their own claims data.
Yep.
Then there is clinical data they kind of can see access into maybe from providers. What's your role in all of that? Are you getting both sides of that data, and how are you getting the data from the providers to put it together?
Yeah, so we start with building the database with all of the claims data for all of their members, and then using sort of a model that says for their top relationships to providers, we would go out and get the EMR data and take that and combine it into the claims data for this complete view of the customer. And so we ride on top of their BAA, we have a business relationship agreement, and therefore we're able to get that data and create a real-time interface to map it and put it into one FHIR database so you have it all together.
Is that, how are the providers? Is that relatively easy? Are they giving up okay, or is there a lot of arm twisting required?
There's arm twisting, but if we talk about value with them as to how they can benefit from this, how some of their processes can improve by creating this FHIR data interface, and also so they don't have to build these interfaces again and again, they build it to one health plan, and then they can leverage that again and over. So yeah, it's a little bit of work, but they're starting to understand the value that it creates.
All right, so what are the plans doing with this? Because they typically haven't had clinical data in the past. Now they're starting to get it. You're building, you mentioned before we turn the tape on, you're building a sort of platform where they can, assist an analytics tool where they can go in and start looking at it. What are they going to get out of it? What change is going to get made because of the data you put together?
Yeah, because this is the first time where you actually have claims clinical data in one data model, in one repository. You're able to run both, claims analytics or population level analytics against it, so that what you're starting to do with this current timely comprehensive data is get better outcomes. And so into some of your existing processes, they could be HEDIS or value-based or quality. You're actually now using the most current data, so you're going to get the best answers to your existing processes.
All right. One other thing that's going on, of course, is that people move plans a lot, and there's a new legislation or regulation about payer-to-payer. Tell us where that is, where that's going, and what that will enable people to do.
Yeah, so on payer-to-payer, the government had said you need to be able to provide for patients to make a request on prior payer data across any of the plans that you've been in over your lifetime. And what happened was they didn't really tell the standard to the data format. So they took the reg back, and now they're going to re-release it. We're thinking maybe late spring, early summer, where it's going to say that data has to be in FHIR format. So what will happen is that a member can make a request for their historical data to their current plan. We will then go out and request that information on their behalf and bring it back in FHIR and merge it in, ingest it, so to speak, back into the database. And now the plan has that complete view, especially for a high-cost, high-risk patient. It's amazing to have that complete longitudinal view of their claims history.
How do you think we're going to do in terms of getting that? I mean, if you have somebody who's a complex cancer patient or whatever that's been treated over maybe a decade, there's all this stuff going on. They probably haven't had it in one place before, if they've had it in a plastic bag where they've been carrying it around. Do you think we might see some real changes?
I think that, once we start doing this, we're all going to be surprised by the possibilities. I think we're going to be able to provide, not only just better care, but even a better service model, because you're not going to have to go run around yourself and try and find records. You're not going to have to request paper records and then bring all of that with you. This is all going to be able to flow together, right? So if I get that claims history and then someone wants the actual provider data, you know, the historical tests or any of the doctor's notes, we can bring that together. And so now that patient's going to feel better about the service they're getting. The plan's going to know better how to sort of help with the care plan and have the lowest and best cost. And the provider actually is going to actually be able to give better service. So I think this one's going to make a big difference.
All right. Okay. Lastly, on 1upHealth, you've been there a couple of years as CEO. As I mentioned, it was launched at Health 2.0 a few years back. Tell me about the money you mentioned off screen. If you can keep raising money and keep customers paying you, tell me about the money you've raised and tell me about where you are as a business.
Yeah, we've done through, you know, a seed round, an A round, and a B round. You know, we've raised up to $35 million so far. You know, we grew, you know, 1,000% over the past couple of years. And so we continue to grow. We're at 100 people. We have 45 customers, 30 million members on our FHIR repository. And so, you know, all stuff looking up and to the right and feeling good about the future.
Fantastic. I'm talking to Joe Gagnon. He is the CEO of 1upHealth. Thanks for your time, Joe.
Thank you.